Good morning, everyone. Thank you for joining me on Saturday morning. I hope everyone is doing well, and we're all ready to go back to work. And it's hopefully we're going to have some good, exciting news and be able to return back to our patients and be back to some normalcy. Today's presentation is supposed to provide a practical guideline over the last couple of weeks, actually a couple of months. I've had numerous conversations with with many colleagues about what the future is going to look like and for us returning back to our offices on a full-time basis. And this presentation is basically just meant to be as a guideline. We have a lot of information here. We will be sending some follow-up emails with website links and some forms that we're going to discuss today in the presentation. The format is going to be a little bit different today. We don't have a moderator, so I would kindly ask you on the panel below, you will see Q&A, polling, raise your arm and things like that. If you could just write your questions in Q&A, and if you don't mind, we're going to wait until the end of the presentation to go over everything and answer any questions. We have about 15-20 minutes reserved for that. And I think this particular topic, I'm sure, will raise a number of questions that I want to make sure we have enough time to cover all of them. So let's start first of all with good news. This came in yesterday from Illinois State Dental Society. We can officially go back to work. Yay! Illinois State Dental Society petition to the governor's administration and Illinois Department of Public Health to begin responding, reopening dental offices. And so starting this coming Monday, we can officially start seeing routine oral and dental care patients. We can provide routine oral dental care. So that's very great, exciting news, exciting for everyone, for us as clinicians, which we all couldn't wait to get back to our practices, and obviously for the patients as well. The question that remains is, what will our practice look like when we come back to a full-time basis? We've been seeing patients throughout the quarantine time, emergency patients, and have made a number of changes to our practice, and they're still kind of changing and evolving. But what will our practices look like in post-COVID-19 era? Will there be any changes? Will there be any permanent changes? And what should we anticipate and expect? I think it's reasonable to assume that there's going to be some changes. I think that's kind of inevitable. But there's not really a lot of guidance from local, state, and federal governing bodies, and certainly professional organization are giving us some information, but I think it's up to us to kind of discern through all that information and find things that are applicable to our practice and implement them for our patients. So this is a picture taken in New Zealand as recent as a couple of, I think, weeks ago. This is a dental practice, and this is how this particular clinician chooses to practice in their office. I don't know if this is a nationwide. I didn't really do a lot of research on what the recommendations are and guidelines for dentists in New Zealand, but it's kind of to me it's a bit of a scary picture. Certainly clinicians wearing, an assistant wearing a hazmat suit. They have a respirator. The patient kind of sitting pretty much just with a dental bib, which is fine. But if we were to implement a model like this, and I'm not, I certainly hope that this is not going to be the case, but if we were to implement a model like this, then a proper protocol would be to have a separate room where you can properly decontaminate your respirator and shed your suit and things like that. And then another question remains is, we all know through the research that virus can survive in the air up to 3 hours. Okay, so are we to shut down this particular operatory after we're seeing a patient and decontaminate it for 3 hours, or wait 3 hours until we can see the next patient? So a lot of questions. I don't think that that's really, really clear at this point in time. So one thing that is clear and keeps coming up in a number of different presentations and a number of different recommendations from different governing body is that some use of personal protective equipment. So I think to some degree we will need to adapt it. In our surgical practice, we've been wearing PPE or part of PPE for a number of years, pretty much part of practice. But PPE is definitely going to need to be adapted to some degree, at least until the epidemic subsides and we have a cure. But what is PPE? Well, PPE is basically personal protective equipment, contains essentially some kind of isolation gown. Patients or clinicians and the assistant have to wear a N95 mask or high respirator, some form of shield, a facial shield is required. There's some alternatives to N95 mask. You can also add bouffant cap and shoe covers to this gear as well. This is, by the way, from CDC website, and I would strongly recommend that if you're planning on adapting any of CDC guidelines on PPE to your practice, that you visit the website. And there's actually a really nice video on how to safely put on and remove the PPE in the practice. Even though we're doing it on a daily basis, I had my staff watch it numerous times just to make sure that we're on the same page and following appropriate guidelines. So at the end of the day, what is the risk of contracting COVID-19? What is the risk of COVID-19 exposure? This came from a presentation of the American Association of Oral and Maxillofacial Surgery that they put together a couple of weeks ago, providing some guidelines to oral surgeons. And this is from their presentation. If we're talking about asymptomatic patients, meaning the patient that's been checked and afebrile, not having any cough, any other symptoms, has not had any exposure to COVID-19 patient in the last month, the risk of exposure is not that great. So it's 15 per 10,000 or 0.0015%. So it's not really that significant. But as clinicians who provide care to or work in the oral cavity, I think one of the most important things for us is masks. That's the number one device that protects us from contracting, us and our staff from contracting the viruses and other airborne diseases. So masks are extremely important. And so I will spend a good portion of the presentation today kind of discussing masks and discussing what's available and what's recommended. So this is a nice summary, a nice guide to use for when you're looking at the masks and comparing it. So N95 is kind of in a league of its own. It's offering maximum filtration for clinicians. And it's supposed to filter about 99.9% of particles that are 0.1 microns and less. It's really kind of a gold standard when it comes to airborne pathogens that are as small as 0.12 microns. If we look at the surgical mask, which is a level 3 mask, you can see that actually the filtering capacity is not that dissimilar. It also can filter up to 0.1 microns and about 98%. So it's I think that surgical mask, a level 3 mask, is a very close second. And so, as we will discuss further, the lack of N95 mask and lack of quality in N95 mask may force us to use other alternatives as well. Of course, the facial shields is becoming more of a important part as well, and we'll talk about what my staff is wearing, and you can make a decision what applies to your practice. So everyone is talking about N95 masks. I don't think that too many of us really were aware of N95 or KN95 masks before this virus epidemics took place. Now everyone is talking about it. It's virtually impossible to find it, to find those masks online or through resellers. And a lot of recently, a lot of KN95 masks have been popping up. So what I'd like to do is kind of provide a little bit of a comparison between N95 masks and KN95 masks. So if we look at the pure information on the comparison, these kind of requirements between N95 mask and KN95 mask, you can see they're virtually similar. Their filtering performance is about 95%. The flow rate is about 89 or 85, excuse me, liters per minute. The flow rate is about the same. And pretty much all the requirements are met. So we're talking about, if we're talking about, you know, well manufactured to the standard KN95 mask, there's virtually no difference. By the way, FFP2 mask, which is also on this list right here, is the European equivalent, and then you have a Australian and New Zealand equivalent, Korean, as well as Japanese equivalent of N95 masks. So unfortunately, the situation has gotten worse with counterfeited masks and really that masks that are being sold to the clinicians that are not up to the standard, and that's kind of where it gets bad and at times really ugly. The National Institute of Occupational Safety is put together guidelines that have to be met in order for the N95 mask manufacturer to be met. And this is kind of a list that kind of allows us to discern and decide whether or not the mask is counterfeit or actually the real deal. This is from a box of N95 masks. This is the front panel and this is the back panel, and you can see that the NIOSH name and logo should be clearly displayed on the panel, and that's meeting the criteria. It is N95 masks. We have also the TC approval number in the back with approval holder's business name, the model part number, and the manufacturer number are all included here. So this particular mask happened to be made in China, but it's a legitimate mask and will provide not only appropriate filtering capacity, but also appropriate seal as well. And this is unfortunately what's on the market right now. A lot of counterfeit masks that really don't meet the either filtering or seal requirements that are put forward by NIOSH. So unfortunately, the N95 masks are nowhere near to be found. They kind of disappeared and maybe being rationed to the hospitals and surgical centers and things like that. There's a lot of popping up, a lot of KN95 masks, and so it's important to understand, since we already looked at and we kind of know that properly made KN95 mask would provide the same filtering and protective properties as N95 mask, but unfortunately, there's also a lot of counterfeit masks that are there. And we need to, this is a 3M, this is a picture of 3M KN95 mask, and you can see that this mask has straps, rubber straps that are supposed to go around the head, supporting the occiput and the neck, and that's kind of giving the proper seal around the nose and the mouth. So a lot of KN95 masks that are being sold right now have ear loops. Okay, and that's an issue because they're really not providing adequate seal that KN95 masks should be providing. Well, a lot of resellers and manufacturers alike will tell you that our masks are FDA approved, and it's a red flag because FDA does not approve any masks, any surgical or otherwise N95 or KN95 mask. There's FDA registration, which means that FDA looked at maybe some of the requirements, and some of the requirements have been met. Still not a guarantee that the mask will meet all the necessary guidelines. But if someone tells you that our masks are FDA approved, be aware of it. So the situation, unfortunately, has gotten so bad that it's prompted the state to issue, particularly a lot of states, in particular Illinois, to issue the statements regarding the counterfeit and faulty masks. One of the websites that may be helpful to you when you're looking at purchasing KN95 masks is this right here, and we'll provide in a separate document so you have all the links and all the websites readily available for your reference after the presentation. But if you click on this link right here, it will give you Appendix A. This is from the FDA website, and it gives a list of approved manufacturers. Again, it still doesn't mean that the masks that we're getting, even from those manufacturers, meet all the requirements, but at least it's a good start. The situation, again, has gotten so bad that Illinois Department of Public Health issued a statement a couple of weeks ago to discontinue using any KN95 respiratory for procedures require use of N95 masks. They're asking distributors to start distributing those masks and that are not part of that Appendix A that we just discussed. Is asking clinicians to remove from the service any KN95s that have already been received. So the situation is really not great when it comes to getting those masks to begin with. I mean, there's a very long wait period, and there's very few resellers that actually able to procure those masks to begin with, and then we're now on top of it, we have to deal with counterfeit and poor quality masks. So this is an example of two masks that unfortunately we received. We placed the order about a month ago. This came from a reseller that I found online, and again, out of desperation, we all wanted to protect our staff, ourselves, our patients, most importantly, and this is definitely part of this requirement. So if we're looking at this particular mask that arrived, you see a lot of different issues here. First of all, it came loosely packaged. They're packed in a little plastic bag, for each plastic bag. You can see the straps here. There's one test to test the mask also for its quality, and that's to pour some water inside the mask. And if the mask is constructed properly, there shouldn't be any leakage of that water. Unfortunately, this mask did not meet that requirement at all. And I was on the phone with the reseller of this particular item, and the call got escalated to the VP of sales, and I spent about an hour and a half educating the guy. The unfortunate part is, this particular company actually wants to provide protection to us and wants to provide quality equipment to the clinicians and understands the severity of the situation, but they're not simply educated enough to be able to discern and decide and bring the quality stuff here from, in this particular case, from China. This is another mask that we received in very small quantities, and this came from a very prominent reseller that's been in the United States for many, many years, and provides a lot of different supplies and equipment. So when you look at the map, and the mask was sold as a KN95 mask, it's we pay significant premium, obviously, to obtain this mask, and there's an FDA logo right here. Again, we know that it really doesn't mean much. The mask is registered, or this company rather registered in Appendix A, so it's listed in Appendix A, so that checked out. The water leak test passed too, so that's at least the filtering capacity is good. But this particular mask comes with again earlobes, and we know that it doesn't provide adequate seal, and therefore it's not really appropriate a KN95 mask. I tried to call back the resellers and kind of explain and educate them. Fortunately, I didn't really get a phone call back, so it's kind of a sad reality. But I just wanted everyone to be aware of really, we're paying premium dollars for masks, and they're so critical and important for us. And just make sure that use your discretion and do your due diligence and research before you're going to be paying those premium dollars for the masks. So when it comes to KN95, the warning signs is if you have an FDA logo on the box, FDA registration certificate as a proof of FDA approval, that's a red flag. Ear loops and loosely packed mask without any packaging or labeling. So another interesting and elegant kind of solution to some of the problems that we have is this this application. You can download it on your smartphone. It's called Bellus 3D, and it's really neat. It allows you to scan your face. The scan is then taken, and a frame around your facial features is fabricated, and then that could be printed. This is they used to generate that STL file that you could email it to yourself, and this is a frame that we printed in our office. Now I think they're offering the service where you can they will actually print the frame for you. And I believe for the month of May, they're doing it at no charge, or otherwise charging maybe 99 cents. But this is provides it's very comfortable. And when you're wearing a surgical mask, it provides a nice kind of additional seal. And maybe for those N95 masks that have ear loops and proper filtering capacity, may be a good feature to use as well. And this is their website, and the information that you can readily obtain. It's very, very easy to use. Once you download the application, it will walk you through the steps, and will generate that frame for you. There's little hooks here that the mask can hook on, and it's very comfortable around your face. So, well, at the end of the day, all this additional PPE equipment that we're just discussing and talking about, how does it going to all play out for our practices? We are small business owners, and at the end of the day, we have to cover our expense. So the gowns, additional masks, shields, additional equipment, and everything else, we calculated that in our practice, that's and price gouging, of course, as well. It's adding about $60 to $80 per case on average between the surgeons and or the doctors and the assistants' gear. We also, by the way, have our front desk, and not to the same degree. They're not wearing N95 masks, but very similar surgical masks, but they're also wearing PPE, which we're going to discuss later in the presentation. So $60 to $80 average additional expense per case. that's significant. So in fact, ADA is aware of the situation, and right now, at least at this point in time, the recommendation is to use the D1999 code for the to build this out for to the dental insurances. Now, we all know, if anyone has ever used the 1999 code, which is unspecified preventive procedure, most of the time dental insurances will not really cover anything. So it still remains to be seen. I hope that at some point in time, the ADA will come up with a specific code for, at least for the time being, until we don't have to require to use PPE equipment, or until the prices will stabilize and normalize and will go back to normal, because we're paying 3, 4, sometimes even 10 times more than we used to pay for the similar equipment and supplies in the pre-COVID-19 era. So we did submit it to the dental insurance on a couple of occasions. It remains to be seen what the coverage is going to be. I'll definitely keep everyone posted, and once we get the information back and from the insurances, I'll update everyone on what we're paying and what their comments are. So what additional equipment and supplies can we use to protect our patients, our staff, and ourselves in the practice? Extraoral suction has been around for some time. I do have to tell you, there's not tons of research on this, so I take it with a grain of salt. This particular unit has been around for a number of years. It's by this company called Vanneman out of California. They're completely sold out. I think they're not even taking orders right now. They are available through the resellers in different like Shine and Patterson. So I don't know what the wait time is on those. The unit is very simply design. It actually has what's called a HEPA filter. We're going to come back to this particular filter a couple of times during the presentation, but HEPA filter essentially is a filter that's been used for a very long time. It's supposed to filter about 99.97% of all the particles that are up to 0.3 microns in diameter. So kind of a little, so our virus is probably not going to be filtered as effectively if it's just a single viral particle. Of course, if it's attached to something, and it will likely filter. So basically, the air is, this particular hood is placed right next to the oral cavity as you're working. It's supposed to absorb all the aerosols that are in the air coming from the dental procedure. It goes through the unit and through the HEPA filter. It gets filtered out, and then the air comes back out through a little grid right here. The hood can be changed between the patients, and there's some instructions on how to keep it clean. So that's one of the units that's available right now. There's a number of units that are coming from China, and it's kind of an interesting experience. I contacted, first of all, you can buy a number of them on Alibaba, which is an alternative, which is a Chinese version of Amazon. This particular unit is manufactured by Dental Tree Company. Interesting unit. They actually put 2 HEPA filters right here. They put a little UV light at the end to hit the particles as they're coming through the both filters. They're retailing for $720. And unfortunately, you have to kind of read between the lines once you start. I contacted them about a month and a half ago and been for a week going back and forth on email. After email number 15, I kind of realized that this is not really a viable option as the price kept changing and availability kept changing. The additional cost based on the email that we're kind of going back and forth, and as I was trying to find out more information they're not very much forthcoming on additional information, but this particular unit will ship to the United States for additional $580, which should be added to the cost of this. And then when it goes through custom, there's going to be, I'm sure, additional cost for the through the custom, and it could very easily cost up to $2,000 before the end of the date. So, but that unit is available, and this, if you Google extraoral suction and dental tree, that is usually on top of the search. They're spending a lot of money on their SEO, and it pops up very readily when you do a search for extraoral suctions. Another unit also from China. By the way, all of them have about a year warranty, and really not a lot of again research. There's some specs that you could look at and compare. This particular unit has a HEPA filter, pretty much similar to what we discussed, a little bit differently structured. There's additional filters here too. They're claiming that they can filter less than 0.3 microns of the particles, which there's no way to verify that, but that's just another option. And I think the cost is very similar when you add the shipping and the taxes and everything else. This is a unit called ADS, and it's also made in China, but it's been sold through resellers here in the United States. A few notable differences with this unit is at least resellers claim that the motor is made here in the United States. They do give 2-year warranty on this particular unit. When I looked at a number of different designs for this particular unit, what I really liked is the fact that it goes through the filter, initial filter, and then it has a UV light that's kind of internal here before it hits the HEPA filter. So you're hoping that all the particles, small particles, viruses, and things like that are going to be killed even before they get to the HEPA filter, and then HEPA filter filters everything out, and the air comes out. So I think everyone can make a decision for themselves if, in fact, this is a good adjunct to your practice. We've purchased a couple of these units and should be arriving in the end of May, beginning of June. I'll keep you posted on my experiences with them. The cleaning, the little cup here can be re-sterilized. It comes with, actually, a single unit comes with a number of different cups like this, and then you just run hydrogen peroxide vapors basically through the unit to kind of to clean it out and between the patients. Another option is INTRAORAL suction or ISOVAC. I don't personally have a lot of experience. I included it here for the, just to give additional options, and it's certainly available and seems like a good alternative. It's an intraoral suction and just works as pretty much regular suctions. It's actually attached to the same hoses, and maybe a good alternative for some practices. So air purifying system. So we know that the viruses can survive in the air up to 3 hours. I don't know how critical it is. You can certainly drive yourself crazy thinking about it, but air purifying system seems to be a good addition to the practice. I know some of our colleagues have already had the system in place. This particular one is a surgically clean air. Been around for a while, I think up to 10 years, and the 2 units that they have a flagship unit. I think it's called White Sierra, Sierra Mountain, something like that. Anyways, it has a number of different filtering systems here. It has a UV light, which is definitely a good thing. Same HEPA filter as we discussed before. They're claiming to be able to filter particles that are less than 0.1 microns. I don't know, can attest to it. I've seen the sales brochure, but I haven't really seen any scientific information. This particular unit actually will run you about $7,000. And the smaller units here are more suitable for the operatories. This is, I don't know exactly, $2,000 to $3,000. Again, we have HEPA filters. I don't know exactly the design of this particular one. I'm assuming it's similar. The website only provides the information on the bigger unit with UV light. I don't know if this one has UV light. Maybe it does. But in any case, this could be placed in each operatory. If nothing else, it will purify the air, so which is always a good thing. By the way, BioHorizons are now reselling those units, and so if you want to find out more information, you can reach out to your friendly BioHorizons sales rep. In our case, it's wonderful Oliver Rohr that is always available to provide additional information. So what are some other alternatives? Well, you've got IQ Air. This is basically coming from my research and reading about air purifying system. I'm no expert certainly in that, but I can discern and read the information that's available and what makes sense, what doesn't make sense. So when I was reading about IQ Air and its specifications and what it offers, actually made a lot of sense. They have what's called HEPA filtration system, and HEPA filtration system is basically supposed to filter additional particles, so which is always a good thing. Particles under 0.12 microns, which is wonderful. The smaller, the better. So this particular unit is actually sold as a medical unit, and so for hospitals, for medical offices, dental offices. Certainly could be used residentially as well. But to me, it makes sense. I don't know some of the comments. If you go on Amazon, you'll read that this particular unit, you can smell certain odor coming when it works for a little while. I don't know. I haven't had really experience, but just included it here for completeness. Again, this is just as one of the options. Another option that's available, and this is kind of a workhorse of air purifying system, is this unit that's made by Honeywell. It has the same HEPA filter, and according to the manufacturers, again, will filter, all of this, the above, including bacteria and viruses. 0.3 microns is is a cutoff, and it's been around for a long period of time. Maintenance is very low. You have to change filters. I think every year, 2 years, there's actually 2 filters here. It's available, at least up until 2 weeks ago, was readily available on Walmart for $224. But we got a few in our office, and they've been working okay so far. Portable UV devices, again, just edited here for the completeness. So, the more I read about it, the more I realized that there is really no guidelines, no unity as far as the efficacy of this particular devices, and it could they're designed to decontaminate a small surface, and they just simply may not be as efficacious as they're claimed to be, and may give a false sense of security. So I'm not completely sold on portable UV devices, but they are available. There are bigger devices, like medical grade devices, and they certainly have place in cleaning the air and killing all the microbes and viruses and things like that. These are hospital grade devices, and I don't know what the availability is. If you were to purchase one, they're certainly available. There's a couple of different manufacturers out there. They go through those response model to be tested. They do microbiology labs testing where the rate of kill is measured for various pathogens. They do test them with environmental effectiveness and clinical outcome studies. So all this information is readily available on all of those units. I found an interesting, informative actually website. It's called Microchem Lab. It's a lab that does some viral testing, bacterial testing, and they have a really nice summary on a number of those units. So I can definitely provide that information if anyone is interested in reading what the recommended units are and what their specification, but certainly is available. I think it takes about an hour to clean the room. You would have to wheel a unit like this into the room, close it, and let it do its work. Another thing that can be added to our protective things is UV light devices that could be essentially assembled into the HVAC system, and there's a number of them out there. There's commercially grade. You could use it, by the way. There's some residential one too. So if you want to install one for your home, they're available as well. There's a lot of reviews and things like that on different devices, and that they're available. But it seems like a good idea, especially with some of them having a titanium coil that allows the air to recirculate and to kind of really re-sterilize and clean all the airborne pathogens. I think that's really nice device. So I would encourage, if you're interested in something like that, to talk to your HVAC person and find out what they recommend. So where do we buy personal protective equipment is certainly a big challenge. We've been dealing with that throughout this pandemic, and I can tell you that our experiences with different companies online have not been stellar. So I would probably caution you to avoid using any of those resellers that are popping up like mushrooms now and bringing a lot of times defective equipment to our country. So I think the best bet is to work with your dental resellers, and I think there's a sense of security there. At least they go through some vetting and look at the supplies that are being sold. So I know your experience may be different using the online companies, but we have not had great experience. This particular company, we ordered those KN95 masks that were substandard, and you know, they were very responsive, and I think deep down, I think they want to do the best they can. They just don't have any ability to, or knowledge really, to look at the quality of the products that they sell. And they promised to send me a shipping label about a week ago. I still haven't received it. And this particular company, you know, were trying to get some of our protective gowns that they promised to deliver, charged, and have not delivered. So just be cautious when you're using those resellers. And again, if they're unproven, I would probably recommend that you deal with your dental resellers directly. This is a very useful website, osap.org, which really gives clinicians a lot of additional information. It actually also has a Excel spreadsheet that you can download with recommended equipment, PPE equipment, and some of the manufacturers that are producing it. Doesn't mean that you can procure it, but it's a really good reference. So I would encourage you to use this website for additional information. It also has a link to ADA where you can find out latest news and things like that. So what have we done in our practice since the beginning of this COVID-19? Well, we've implemented a number of changes, and remember back in the middle of March when this whole thing was happening, we're kind of reading CDC guidelines and keeping up with the news and trying to predict and kind of anticipate, you know, the changes that are going to be taking place and occurring. So the first thing that we did is we printed, and this comes straight from the CDC website. The two pictures here, again, readily available. You can just download them, print them, and post them on the door. So before the patients are coming in, they're warned about signs and symptoms of COVID-19. At least I think at this point in time, everyone is aware of it. And but nevertheless, again, reinforces to the patient if they're having cold, fever, chills, cough, or have traveled outside the United States, or have been exposed to within the last month to a COVID-19 patient, they should reschedule their appointment. The shield for the front desk, I think it's one of those things that I think in this day and age is becoming more and more important. And so we used to for years we used to have open front desk where I think it was more personal for the patients when they're coming in. They feel more welcome rather than having this dividing glass that's divide patient from the staff. But in this day and age, I think this is important, at least for the time being. In your grocery stores, you're all seeing those shields popping up all over the place, and not just grocery stores. They're talking about putting something like that, dividers in schools and things like that. So it's all over the place. And so for the front desk, you could certainly put glass shields. There's a number of companies that will gladly do it for you. There's I was giving a wait time for and that was a month ago, about 6 to 8 weeks. That's based on how much demand out there and how busy they are. And I think that's unfortunately the case was with the most of those companies where they found that there's such a high demand, they just can't really accommodate it in a timely fashion. This is a really nice alternative that we found online, and I think that for a lot of you out there, that may work very well. We actually ordered a number of them. We got a quote from one of the glass companies to just for the front desk, it would run us $2,000 to $3,000, depending on what we wanted, how high we wanted to go here. This is almost 3 feet here, and provides a nice barrier here. It's very easily could be removed, cleaned, and it's only $59.99 on the website. I think it's on Etsy, but also available on Amazon, things like that. So we ordered a number of them for the front desk, and I think it's a nice alternative. You can see there's a little window right here for patients to slide in and for the staff to slide documents. By the way, I just wanted to point out this is kind of what our front desk looks like when you're walking in. They're wearing a surgical mask on top of a regular mask, bouffant cap, a little coat here. Disposable coat, and wearing gloves when they're handling paperwork going back and forth. So what else have we done what else have we implemented in our practice? I think it's important to pre-screen patients on the phone. We do ask them the same questions that we have posted on the wall or on the door when they're coming in, just to make sure that if there's any chance that they may be exposed or have active infection, obviously they don't expose others. And most of the patients are very responsible and will readily give you that information. The paperwork registration, if at all possible, should be filled out online in advance of appointment. We have an option through our website where patients can fill out this paperwork online, and that not only is much safer nowadays, but also saves a lot of time. So we always encourage them to go ahead and do that. If you don't have that feature, I think it's a nice feature to have on your website. Patients, when they arrive, call from the car to check in, and we minimize or eliminate waiting room wait at all. So I think for the time being, our waiting rooms are going to be quite empty. We're trying to minimize or eliminate really people sitting in the waiting room, and rather have them check in right away and brought to the operatories. One of the things that, so there's a lot of suggestions, a lot of recommendations. One thing I think that everyone should implement is this kind of infrared thermometer. I think it's absolutely critical for screening patients. You know, it's basically you don't have to touch the patient. It gives a very accurate reading that's taken at the front desk when upon patients entering the office. And anyone with, if they're afebrile, of course, they're going to be seen. If anyone has elevated temperature, will be rescheduled. So a lot of them are available online. They're fairly inexpensive. I don't really have any specific recommendations on the model. I think just reading reviews and seeing what's recommended, I think would serve you well when you're making a decision what thermometer to buy. Another thing that we adapted early on is a pulse oximeter. So not only are we taking temperature on the patients, but also using a pulse oximeter to check their oxygen saturation. And it's an important adjunct. Not too many people are talking about it, but about a month ago I read an article that kind of made sense. That you know, certainly with the pathophysiology of the virus and what it does, how it's affecting the breathing and oxygen exchange in the lungs and oxygen saturation. The pulse oximeter will be is a nice adjunct to screening for screening patients and picking up things. I can give you a personal story. It happened about a week and a half ago. That a patient came in, was an emergency patient. We took her temperature. She was afebrile, looked fine, and answered no to every question we asked her, filled out the form, signed it, and then we used the pulse oximeter to check her oxygen saturation, and it was hovering between 89, 87, 89, kind of going back and forth. So we used another pulse oximeter and got the similar reading. So then she turns around and says, well, okay, I had COVID-19 a month ago, but I was told by my physician that I'm fine and able to return to work, and I don't have to quarantine myself. So I don't know if it was exactly a month ago that she was exposed, maybe 2 weeks ago, since she already lied to us once. But you know, most of the patients obviously are very responsible, but you know, it just happened to be just hopefully a rare example. But pulse oximeter helped us to screen that patient and not to expose the staff unnecessary to someone who is active or maybe just recovering from COVID-19. Very inexpensive units. They're about, you know, I think this is the pricing. You know, my staff wipes it thoroughly between the patients and detoxifying the surface. You could also download an app on your smartphone and buy a little cord, and you can use the smartphone too as a pulse oximeter through a little application can be downloaded. A number of them are available. Again, sign at the front desk, again, reinforcing everything that we just talked about. Two forms that we adapted for our patients, two new forms. This is a questionnaire just to make sure we have everything in writing from the patient. This was, we adapted it from the AAOMS, my insurance website. And by the way, we'll also include it in the follow-up email. And if anyone wants to adapt those forms, by all means. One is the questionnaire, and then this particular form is essentially designed to tell the patient of the risks involved and things like that about COVID-19 exposure and stuff like that. Just a little additional, I guess, safety net from medical legal standpoint. We definitely adapted it, and it makes sense to me. So this is our typical gear for a surgical procedure. We're wearing PPE. Everyone is. 2 sets of masks, the N95 and regular surgical mask over it, shield, bouffant cap, gown, shoe covers, of course, and so that's that's what we're doing in the office right now. I mean, the only thing that we've added probably is an extra mask and a face shield, eye protection, and the face shield. Eye protection we had before, the goggles, but face shield as an additional measure. And you can make a decision in your practice the extent to which you want to adapt PPE. I think it's important to reassure the public at this point in time that obviously our offices are safe environment for them to return to, and not just. I mean, I think there's going to be public fear in general when it comes to patients getting out of their houses, especially the ones who were strictly quarantined for all this time, and it really is important for our practices for us to reassure them that they are that we're taking all the necessary precautions to minimize their risk. This is a little disclaimer that pops up on our website. I would definitely recommend that if you haven't done so, to have something like this on your website. Social media, if you're using social media to communicate to your patients that you're taking all the necessary precaution, I think is also a nice thing to do. This is I found this on one of the website of this particular dentist. He is in California. He had some pictures there. I like the kind of his summary, so I included in the presentation. We'll include it also with the information that we'll be sending to all the participants today and all the referring doctors to use it as a reference. You can kind of paraphrase it, but use it as a reference to create something for your website. ADA has a good source of information, and they compile this through the ADA link. You have a sample letter to patients, guidance on pre-appointment screening. So I would encourage you to visit the website, and there's some information, helpful tips that you could use as well. So what we know right now regarding COVID-19, it can stay in the air for up to 3 hours, on the copper surfaces 4 hours, cardboard 24 hours, stainless steel 2 to 3 days, and polypropylene plastic up to 3 days. So having those surfaces wiped thoroughly is definitely going to be important, and we're scheduling patients 20 minutes apart for the surgeries, and it takes about 10 minutes to what we call decontaminate the room. Again, the air is something that is kind of really difficult for us to implement. Would mean you can't possibly shut down one operatory for 3 hours. We try to do not to use the same op within an hour, and I think that's more than adequate, but this is just, again, for your guidance. So what we do know with COVID-19 research, and this is a recent publication that was published, that the way that COVID-19 actually invades the body, we know that it has specific affinity for ACE2 receptors. So ACE2 receptors are prevalent throughout the cells in the body, and specifically they're prevalent in ciliated cells and goblet cells of the nose. So I think that's probably the researchers are kind of pointing to those cells, specific cells, as the entry point for the virus to enter our body. So so it's all in the nose, and or partially in the nose, maybe oral cavity too, but certainly in the nose. I mean, there's some talk about the ocular exposure as well, but I don't know that it's been proven. Just one of the personal hygiene tips. That's something that I read, kind of made sense to me, and something I wanted to share with you is the use of a Q-tip and the soap. Essentially, you take a Q-tip, wet it, impregnate with the soap, and use the nasal passages to kind of wipe them, usually in the same direction, maybe like clockwise. Just to clean the nasal passages, and I think that's an extra hygiene exercise that could proven to be quite prudent keeping ourselves safe, especially considering our exposure. There's really not much research on the oral rinses, the efficacy. There's some papers that are showing a particular concentration of viruses at the ductal cells of the salivary glands. I don't think that there's it's kind of definitive at this point in time. We know hydrogen peroxide is effective, so may not be a bad idea for patients to rinse either before the procedure and for clinicians to adapt that as well. The mouth rinse that we're using in our practice, the StellaLife, the plant-based mouth rinse, is actually some plant active ingredients that have shown some antiviral efficacy, so we're utilizing that as well. There's always chlorhexidine. I don't know that the efficacy against the viruses. I know it's there's good efficacy against bacteria, but that's also on the list of oral rinses. And by the way, that's both for the clinicians, excuse me, for the patients, and I think for clinicians too. To gargle was the rinse at the end of the day. I think maybe not a bad idea. Again, as part of the personal hygiene. One thing we know for sure that most resilient immune systems manage exposure to COVID-19 best. I think that's been shown time and time again in clinical studies. And so there's a very strong link between the vitamin D, vitamin C, vitamin A, and zinc. And patients who are optimizing those vitamins have shown better outcomes. So I would definitely encourage all of you, if you're not taking vitamins, definitely optimizing those. I think it's really critical in this period of time, especially as we're exposed to patients that may or may not have the virus. And I think for personal protection and optimize on your vitamin levels, I would definitely encourage you to do so. And 3 different independent studies have shown much better outcome and less progression of the disease in patients who were therapeutic on vitamin D versus patients who were deficient in vitamin D. So it's unanimous that there's definitely a link between that, and it's basically has to do with the immune system antioxidant properties, and it essentially decreases the cytokine storm, which is one of the pathophysiological pathways that the damage is caused to the lungs. So what does the future hold for us? Well, are we really going to need to adapt this PRP or CAPR, part air purifying respirator that you saw at the beginning of the presentation, wearing some dentists in New Zealand wearing? Well, it remains to be seen. Hopefully not. Those units are very expensive. They're around about $1,500–1,600, and you would have to certainly buy the multiple of those. And again, decontamination is a big factor, but I did include it for completeness again here in this presentation. There's I think the game changer is going to be point of service testing. There's 2 tests, as you know, available right now for COVID-19. One is the viral test, and that's a nasal swab that shows whether or not the particular individual has virus in their system. And there's a blood test that finger prick blood test that can show antibodies, and that's basically just telling us if the patient has ever been exposed to the virus in the past. So I think point of service testing, I think it's a very appealing idea, and will give us another layer of protection. Hopefully the quality of those tests are going to be improved significantly, because at least at this point in time, there's a lot of false positives, especially some of the supplies are coming from China with the substandard quality. And so if you have 80% accuracy, I'm not sure that you could possibly cause more harm than good. But point of service testing at the end of the day with reliable device, I think, is going to be definitely something to consider for dental providers. I think things will definitely change public perceptions, right? When we have more effective management of COVID-19, medical management of patients who already contracted it, and ultimately the vaccine. So this is an interesting idea. People are thinking outside the box by putting patients in the box, and it's a plastic essentially container, and provides out of plexiglass, provides an extra layer of protection. It's been adapted by anesthesiologists for intubations and things like that. So I think it's definitely makes sense. Can it be adapted for dentistry as well? Well, someone already did. And, it's, I don't know, you'll be the judge of how well you can actually see what you're doing, and looking through the plexiglass. Maybe another feature of this is going to be magnifying glass, kind of to substitute for our loops. And I think that may be coming up, or I may be giving some ideas to the future manufacturers, and maybe that's the way we're going to be practicing. I don't know. Kind of difficult to do surgeries, I would imagine, doing this, but I guess not impossible if we're really providing a significant improved protection. But just wanted to make you aware of that people are already thinking along those lines. In conclusion, I hope that this COVID-19 is going to be a distant memory very soon. I hope the only thing that we're going to remember from this is this attempt on fashion that I found online. It's kind of interesting take on current trends, but I do hope that we're going to be able to return to some kind of normalcy and back to our usual practices. I'm very excited that we're all able to come back to work. Please stay safe. Always reach out with any questions, any guidance that we could provide. I'd be more than happy. I'm always available.